to you, and thank you very much for being here today to witness yet another milestone in the relationship between the United Kingdom and the Kenya government. Decades after pre-independence, the Kenya and UK bilateral relations were this past year elevated to a strategic partnership by His Excellency, the President, and the Right Honorable Boris Johnson, Prime Minister of the UK, through the signing of the UK-Kenya Strategic Partnership 2020-2025. The partnership umbrellas numerous collaborations, including the health sector, where, for instance, we have a memorandum of understanding between the Kenyatta University Teaching, Research and Referral Hospital and the Ministry of Health on the one hand, and two British institutions, the University of Manchester and Christie NH Foundation Trust. For those who are not familiar with the KU referral institution and what is happening there is that there is a construction of a state-of-the-art molecular imaging center, notably the first of its kind in the East and Central African region, that will focus largely on oncology and investigative radiology. Its construction is now underway, with completion expected at the end of this first quarter, which makes our collaboration on capacity building for its healthcare workers very, very timely. And I would like to say a very special thank you to you, sir, through you to the British government for the support that they have continued to give us, particularly on that area of human development. Ordinarily, healthcare workers are so busy focusing on clinical work that they rarely find time or the opportunity and space to innovate. More often than not, even when they have those very rare moments, they lack the facility to perform them in. Here today, we must give thanks to the British government for his assistance in our establishment of an innovative hub at Kotra, and importantly for offering our medics technical support on clinical services and the opportunity to conduct research in areas of common interest. Ladies and gentlemen, there is much to be said about collaborations that extend well below the institutional agreements that they are based on, and touching and impacting the fabric of our societies and life. As it has done since the formation in the 1980s with the establishment of the renowned Kemri Kilifi Center, the UK-Kenya Scientific and Research Partnership, we accelerate Kenya's vision towards universal health coverage and in a very personal way continue to extend the lives of millions of Kenyans. It is not lost on us that the UK government has anchored our research programs to the tune of some 70 million pounds, UK pounds, in the last 5 years. And for this, we really thank the government and the people of the United Kingdom. In closing, I want to take this opportunity to thank you, the Right Honorable Dominic Raab, and Mr. Secretary. I want to pay a special thank you for finding time, and I know how busy it is. I know the times we are talking about, and for you to dare cross over the seas and come here during the COVID period. I might say that we have been lucky that extent in this country. We have fought an extremely hard battle in very desperate circumstances, but thanks to the people who you can see here, particularly the laboratory people, the lab technicians, the professors who are here with us, they made a very difficult journey a lot more easier. And I want to thank you and applaud you for the great work that you have done as healthcare workers and as professors. So thank you very much indeed. I understand that you're on a very short visit. It would have been very nice for you to pay a few more visits. And I know that Prof wanted you to go to Kilifi. in addition to other things, it's a very warm beach out there. So I think you'd have had a very, very nice time. But you extend that visit then to the ambassador, then to do everything that you could have done for us, including the swimming. But for now, Mr. Secretary, we are so honored that you are here. We feel very, very, very privileged that you are able to be with us this afternoon. And we hope that this is something that we can continue and perhaps reciprocate at some point. We would have liked you to see the rest of the country. We would have liked you to tour our Masai Mara and the rest of the things we are very, very proud of. But I think what is not known out there is that Kenya, in addition to tourism, in addition to the beach, has got fantastic scientists who create things for the world. I welcome you to make the difference.
I think whether you're a health minister or a foreign minister, this pandemic has taught us is the value of friendship, and that necessity is the mother of invention. And one of the reasons I wanted to come here, notwithstanding the lockdown we have in the UK, is because I think we can see the fruits of both of those elements of the pandemic here in our collaboration at KEMRI. We have a very long-standing collaboration, and what is most interesting in the relationship is how two-way it's been, and how the scientific base has been built up here, and why for us as the United Kingdom, coming to see your efforts to roll out and conduct the trials of the vaccine is such a good example of the health cooperation that we need in the future. The fact that our scientists can collaborate, the fact that we can share experience of rolling out the vaccine. We've been through the rollout process, or we're in the process of going through it. And I think most importantly, and with the agreement that we've just signed, we're not just dealing with the current crisis, but we understand that if there's any lesson to be learned throughout this awful pandemic, it is that we need to collaborate more closely, more intensively, and in particular with our closest, most trusted friends. I was blown away by the research and the innovation that we saw here, and the scientific expertise and know-how you have, and we'll take that home and we'll learn from it. And to be able to share our experience of the rollout and the trials process with you, I think is something which is mutually beneficial and will stand us in good stead. God forbid we face another health crisis on this scale. So thank you for your collaboration, and thank you for your friendship.
Thank you indeed. Thank you very much. And to appreciate your support, especially during these times of a visit like this, the impact of which can be very important to our people, particularly in the health sector, and we appreciate that you are assisting us to make this known, not just in Kenya but across the world. I'll be taking a few questions regarding the matter at hand, but in addition to that, of course, is that I would like to take this opportunity to also inform you of the days, the situation with COVID-19 in our nation. And today, out of 136 people, today 136 people have tested positive to the disease out of a sample size of 3,787. That means that our positivity rate is still below 5%. This is a good sign, and we are hoping and praying that this is something that is going to continue. We were waiting to see whether post-Christmas holidays, post the opening of schools, we are going to have an unusual spike, but I think we are still holding fort. Thank you to the students who have gone back to school with a lot of discipline. There is clear hand washing, students are wearing masks, teachers are wearing masks, and there is strict observance of the measures that we have proposed and the protocols that we have given to the Ministry of Education. We are impressed by what we are seeing, and we hope that this is something that is going to continue. We have already been in school now for the last 2 weeks, and so far, so good. As you know, we reported that we had a case which had, in one of the schools in Nairobi, we isolated the child and tested the entire school, and I'm glad to report that everybody was negative. So far so good, and we are keeping our fingers crossed that this is something that is going to continue. So you will be given the details of what has happened today and what has transpired. We can also report that currently we have got some 686 patients who have been admitted to various health facilities across the country. We have got also an additional 1,625 persons who are on the program of home-based isolation and care. We have 30 patients in intensive care units, 14 of whom are on ventilatory support, and 14 are on supplementary oxygen. And 2 we are just observing to see how it will play out. There is also another 11 patients who are separately on supplementary oxygen, with 10 of them in general wards, while one is on high dependency units. In terms of the areas of concern, Nairobi, as you know, still remains our main infectious area, but even then, it is well contained. Unfortunately, we have lost 2 patients today, and therefore pushing our cumulative total to 1,736 deaths to date in this republic. So I once again want to sincerely condole the families of those who have lost their loved ones, and we keep praying and hoping that COVID deaths are something that is going to be in the past tense soon, rather than simply announcing every day. So we condole the families and we'll keep them in our prayers. I would like to take 1 or 2 questions and then we call it a day. We intend to keep the current measures that are there. We intend to keep on a very high level of surveillance. We also want to embark on sero-surveillance to find out, and this institution is going to be key to the way we want to go forward, particularly to test our people and find out how many of us would probably have had COVID and not known about it, and therefore we can tell what levels of herd immunity we have developed. The reason why this is so important is because even as we embark on the vaccines, it is good to know from where we are starting. The whole idea of vaccinating is to develop immunity, to develop herd immunity. And you like to know where are we even as we are starting with the vaccines. The committee that is in place dealing with the vaccines had a meeting even this morning, looking at the logistics, looking at the distribution, looking at the training, on all the issues that you are raising. I think it is important for us to keep in mind that the African countries, especially where we live in Kenya, the matters of vaccinating are very, very common with us. We carry out children vaccination almost throughout the year. So unlike some countries that don't have a vaccination programs, we do have that. So in terms of the personnel, in terms of the logistics of doing so, I think we are pretty ready to carry it out. In terms of the timing of the arrival of the vaccines, I think I'm going to let my colleagues tell you about all that, because I wasn't in this morning's meeting. They were there and they can talk to it. And as far as the variants, I want to get Dr. Amos will talk about that and the various variants. But I do know, and I think if I tell you, maybe you and I can understand each other better than these doctors telling us, because they are going to start on words that... What I do know and what I have learned from my basic understanding of viruses is that the issue of variants and changing and mutating of viruses is normal, and it happens all the time continuously. And one of the reasons why when everybody was closing the borders and we didn't is because perhaps our professors with a better understanding of this advised us to simply keep watching and hold our breath until we are sure that the variant that we are talking about has got a negative impact on our people. Because variants come, some can go stronger, but usually they go weaker. They become weaker. So let me let my colleague, the PS just talk about the preparation we have got, and then I will ask Dr. Amoth to weigh in on variants and the scientific.
A meeting with various stakeholders, just going through the plan that is already been put in place by the ministry. It's important to also know that just as late as last week, we got a confirmation about the allocation of vaccines to Kenya on the AU platform, that's the African Union platform. We also now have clarity on the allocation of vaccines through the Gavi platform. And so in terms of mobilizing resources, we've also got assurance and confirmation that we are going to get funding through the World Bank for the vaccines. So with all the plans now, moving to address the issues that you have raised, the logistical planning, the training of healthcare workers, the communication that needs to go along that, we are looking at being ready as a country by around April. But again, leveraging on our existing infrastructure that the minister has just talked about, it is also possible that we may have the vaccine even sooner in the country. But we are well positioned right now, and we should all be comfortable to know that the vaccine will be in Kenya very soon. Thank you very much.
Very clearly, in a very simple language, that viruses or other pathogens will always continue to mutate in order to continue surviving. Indeed, you have reported 2 cases of the South African variant of the virus that was picked by a team in Kemri Kilifi. We all know that this variant is 50% more transmissible, therefore posing a significant risk in that more people will be infected and therefore could be able to stretch the healthcare system more. This was picked because of our heightened surveillance system. These 2 gentlemen have since gone back to their country. At the point of picking them, they were all asymptomatic. And of good note, again, coming from the scientific world, is that even though the variant is more transmissible, it is not more virulent than the novel COVID-19. It can also still be picked by the routine gold standard diagnostic method for COVID-19, the PCR. And evidence emerging today from US is that the vaccines could be effective against this virus, especially the Pfizer-BioNTech vaccine. So viruses will undergo transformation in order to make them more virulent sometimes, less virulent, or sometimes the transformation is neutral, or sometimes is of a non-significance. So what we are doing is to put into place a heightened sense of surveillance to be able to pick, because already there's also a 3rd one from Brazil. So we'll be able to put into place measures that can quickly be able to pick these specimens, analyze them, to be able to guide our intervention measures going forward. Thank you.
Thank you very much.